You're listening to Business Success in a Virtual World podcast. If you are a leader navigating these new immersive technologies, this is your definitive resource to understand the innovative power of XR, VR, and AR. I'm Tim Barton, Chairman of Creative Strategies, and I'm joined by Barton Goldenberg, President of ISM Guide. In each episode, we navigate through new products, effective strategies, and highlight actual business case studies implementing extended reality into business processes. Our resource website now boasts over 300 case studies, 300 articles, and 100 videos presenting successful examples of businesses using these technologies in field service, training, digital twins, customer service, in medical and manufacturing, and so much more. Check out the website at ismguide.com. Now, on to the next episode. This week, it's a pleasure to have with us Doug Hohulin. Is that, am I pronouncing that right?
Yes, Hohulin, rhymes with no foolin'.
Who is an expert on tech-powered healing, the future of medicine. Doug and I are on a call with a group called Content Evolution every Thursday morning. And that's how I got to actually meet him. And then Barton already has met him and talked with him. But last week we had Dr. Harvey Castro on, who is an incredible doctor and authority on medicine from a doctor's standpoint. And in fact, I do want to plug a book he sent me, which is kind of cool. It's called Apple Vision Healthcare Pioneers, a community for professional and patients. And I've gone through some of it. It's available on Amazon, but it's a great primer of how the Apple's Vision Pro is being used in medicine. And it's a great book. And he's an author, as we've told you in last week's podcast. Dr. Castro has a lot of other books and is quite an authority. But as a follow-up, we wanted to stay within this theme of XR, AR, and AI in healthcare. We invited Doug to follow up with him. I think, Doug, you have a relationship with Dr. Castro as well. Is that right?
Right. We are actually co-authors of the book, Tech-Powered Healing, the Future of Healthcare in the AI Age.
Oh, cool. Okay. So let me just start with having you help introduce yourself to our audience.
Yes, I'm Doug Hohulin, and I worked on AI systems when the AI systems have to be right. So in healthcare, automated vehicle technology, road safety technology, policy, energy, education, areas, legal systems where the AI has to be right. My background is 33 years with Motorola and Nokia. My division at Motorola got bought by Nokia, so I've been 22 years at Motorola, 11 years at Nokia. Worked on automated vehicle, connected vehicle technology on that AI part of the world. I was on the Nokia Bell Labs XR Center of Excellence team for a while. And so I'm an engineer by training. I went to Purdue. But then I worked in business development strategy, working on smart city technology. But one of my passions is around healthcare. Right now, 3 million people every year, according to the World Health Organization, die because of medical errors. Here in the United States, 125,000 people die because they don't follow their treatment plan. And so the question is how do we have a more healthy healthcare system, and can AI be used for that?
So let's start with a question that's a little bit off center for a second. Given your history, especially with mobile devices, you've got a lot of devices right now from Apple, other,
Samsung, yeah,
that are doing wearables.
Correct.
And off the top, before we get into the meat of this, how do you think about that impacting this whole issue of monitoring people's health? Is it good? Is it working? It's funny because I wear an Apple Watch and a Ring, so my two are fighting with each other to give me my data. What do you think about that?
Yeah, so I have actually this blog, The 21st Century, the century of the billions and billions. And like in 1802, there was 1 billion humans on the planet. In 2002, 1 billion cell phones on the planet. 2011, 1 billion smartphones came along on the planet. And in 2022, we had 5 billion people having smartphones. So actually, this year, 2024, is when we had 1 billion people having digital fitness and well-being devices. So the Apple Watch and the
Wow.
other Fitbit devices. So 1 billion people are now having a device. And the question is, can they use those devices to help their health, give them more knowledge about their health care? People who have medical literacy or people that don't have medical literacy, so they struggle with understanding how to follow their treatment plan. They have a 75% higher rate of death than people that do have follow and understand how to follow their treatment plan, how to use their medication. So, I'm excited about AI and XR and coming together with these devices so that people can give better guidance on how to maximize their health. So that's what I'm excited about. And again, we're at 1 billion people, which
Wow.
means in about 6 years, we'll be at 5 billion people having these devices to maximize their health.
Doug, I know this is not, again, I really want to get into the nursing, but just one question follow up on that, because I think all of us wear some sort of a device that we can use for medical monitoring and so forth. The issue is one, and just address it very quickly in your own mind. On the one hand, it's great because you know what's going on in your body. On the other hand, you could be obsessed by looking at it so often that you go crazy. On the one hand, you can send it to the doctor's office on a regular basis and expect them to look at it. On the other hand, you don't want to send it to the doctor's office too often because they get overwhelmed with it. How do you manage these divergent issues?
Yeah, and this is something, Dr. Castro and I come from a technology perspective, but also as a patient perspective, right? He comes from the medical side. And actually, Dr. Castro has an app on AI that you can say, okay, from a patient perspective, how do I understand my illness better so I can engage with this AI? So then when I'm with the doctor and I only have my 5 minutes or 8 minutes on average to the doctor, I can ask really good questions. And even after I get the information from my doctor, I can then engage the AI as well. So this is where I think AI has a tremendous opportunity because it helps educate the patient before the doctor's visit. And then after the doctor's visit, you can then engage this AI as well to make sure that you understand it properly. But yeah, in fact, on your podcast, Dr. Castro was saying, that there's a lot of clinicians that still don't understand the value of this AI. They think it will replace them, which it won't. For the next 20 years, you're going to have a clinician in control that's monitoring the AI to make sure it's done right. But it's like, how do I use these tools to make your health as an individual, make my health better, or the people I love? How do I make sure that they're following their treatment plan and doing the things that the most possible to maximize their health?
Thank you. All right, Tim, on to nursing.
Let's move into our first main topic today, which is what you've been doing in monitoring the area of nursing. As we said, Dr. Castro talked to us about it from the doctor's viewpoint. But as we were talking a little bit earlier before we started the podcast, the nursing industry is going through some real challenges and having to actually learn to use new technologies, which even puts more pressure on them. Give us an idea of some of the stuff you've been working in the nursing area.
Right. Yeah. So I'm on the Kansas University School of Nursing Advisory Board. When I left Nokia, one of my first projects I was working on with the Cable Labs 10G Challenge, and actually T-Mobile actually had a challenge too, where we won prizes to roll out immersive learning in the nursing school with XR technology. So we got 50 HoloLens 2s, or excuse me, Meta Quest 2s for these devices. How do you add those into the curriculum? The issue is how does a nursing student go from being knowing all the facts to being a practice-ready nurse, right? That they can come in and they're not overwhelmed, and there's 13,000 ways the body can fail. And, there's 4,000 different, according to Dr. Atul Gawande, and there's like 4,000 different medical procedures. So as the nurse, how do they understand how to do these procedures? They're also there for patient education, right? So often, we call the doctor's office, but what we do is we get the nurse do I understand what's going on properly, making sure that, the instructions are followed properly and so forth. So that's, how do I go from the nursing students know the information, they're great at taking a test, right? To going from that to being, and that's where I call it being smart, right? You can take tests and you get your A's on your test, to being intelligent, which is being able to achieve complex goals. So like, what procedure do I need to do? And so that's what we were trying to do. We actually won the $50,000 prize at Cable Labs for the 10G challenge on immersive nursing education and teaching them how to integrate XR technology into the nursing program.
So give us a couple of examples of how the nurses are using immersive XR technologies. What type of applications do they like? Is it benefiting them from retention? Is it lowering cost in the hospital? Is it improving their comfort level in dealing? Tell us a little bit about what these applications are doing, Doug.
Yeah, so a nursing student, when they go into clinicals, they can, when you have to do a procedure, right? You can either practice that procedure on another nurse, right? But if the other nurse says, I'm going to put a nose up a tube up your nose, I would not volunteer for that personally, or other body parts. Then the other one is to get a standardized patient where the patient, but that's expensive. It's like $100 an hour where you get a patient. Someone says, okay, I'll be your practice patient, and you can practice on that. You practice on a mannequin, and right now these mannequins are static and could cost $200,000. So these are how the nurses practice, or they practice on a real patient. And as you're a patient, the question to ask if someone comes into the room is, have you done this procedure before? And usually the answer will be yes. The question is how many, then the follow-up question is, how many have you done? And if the answer is only one, it's like, can I get someone who has done 100 of these, right? You want someone who, has practiced quite a bit. So, my viewpoint is, if at first you don't succeed, don't do skydiving, surgery, or any other procedure that can cause harm. And, practice that first in immersive learning, where you practice over and over again. So, I mentioned doing a mannequin. So, they have, they say, okay, you're going to practice, burn situation, right? So you try to do this, like, let's say there's 30 steps to this burn treatment. But you're doing this on a mannequin that's static, and then there's some procedures, if the mannequin is a male mannequin versus female, skin colors could be different and so forth. So these are very expensive mannequins. So the question is, can I use instead a immersive tool where you can say, I want to dial in this, where I'm saying I'm going to have an 8-year-old child that has this condition. Let's say it's edema and it's level 4, and this is the skin color and so forth, and they practice on that. So they can practice the case very specifically. Practice over and over again. So once they get good at it and they follow all their steps properly, then when they're ready to go to the patient, it's like, okay, I've seen this 20 times, and I just go ahead and do it.
And the readiness of the nurses to use immersive technology, they're gung-ho, they're kind of halfway there, they're reluctant. Where's that at?
Yeah, so for our program, one of the challenges is the faculty, getting them excited about adding this to the curriculum, because they have to learn how to use the devices, how you integrated it in. The good news is there's companies out there like CIMEX and Oxford Medical and so forth that are really trying to work on these to integrate, have it part of the curriculum program. But one of the challenges we had at KU School of Nursing is the devices, a Quest 2 is £1 on your head, and even the Vision Pro, Apple Vision Pro is £1 on your head. And, I've used AR devices that, or smart glasses that, make it so much more comfortable to be wearing. Now, you don't have the optics, you don't have the degrees of freedom that you have with a Quest Pro or a Vision Pro. But over time, I think in the next 5 to 10 years, you will have a Vision Pro-like device in a pair of glasses that weigh, 100 grams or less. So anyway, the optics were an issue. Adding it to the curriculum so the faculty understand how do they add this, where it's not just a lot of work. Because, I already know, if I'm a faculty member, I already know how to do the old way of doing things. Now I have to learn how to use an XR device. I need to learn how to integrate into the program and so forth. The other challenge we had at KU School of Nursing is the Wi-Fi systems. In fact, we had to get 5G hotspots, but because the training class was in the center of the building, we didn't have good coverage. But the IT support was a challenge. In fact, the Ohio State nursing program, they got a $1.5 million grant. And what they did is they hired a full-time IT person to solve all the IT problems. So these are some of the challenges of rolling this out. But in the long run, the technology, I think, will be integrated into the nursing program. It will be cheaper to do this than a standardized patient or physical mannequin, giving much more functionality where you can practice on anything. And I think eventually what you're going to have is when a nurse or a doctor, before they're going to do a procedure that they haven't done before or haven't done in the last 6 weeks or 6 months, that they will go into, with their glasses, they'll just put a pair of glasses on and they will quickly do the procedure. Like, okay, there's 30 steps to do this procedure. I will go through it really quick. And it's like, yep, I just get a prep and then I go in and do the actual procedure to the patient.
So, Doug, you mentioned, of course, this with nurses on patients, but I've been involved with scenarios where one of the big issues was training the nurses on new equipment. Some of the medical equipment is just ridiculously complex. And I've been in a couple of scenarios, both with my sister and my brother when they're in the hospital, astonished by the nursing staff's ability to master some of the equipment that was needed to monitor their systems and do all of these things. In the training program, do they add the use of XR and VR for training them on equipment as well?
Well, that's what we were trying to do with this program. And, so how do you, first of all, how do you train to understand how to use XR? Like the Quest 2 or the Vision Pro in each of these devices. But, what I'm finding is, I'm a technologist, so something that takes me a half hour to learn how to do, may take someone, 3 or 4 hours to do. And to set up and those kind of things. So I am very excited about Apple Intelligence because one of the key things is intuitive. Like when Apple's came out in 2000, the iPhone came out in 2007, it was intuitive, right? It just seemed to work. You didn't need to be an engineer to make this work, right? It just worked. It was intuitive. And that's where I'm really excited about AI with XR coming together saying, I want to do X and it will just do that X, right? So, like for instance, if I need to do an IV or work on a device, I can even put on my glasses and say, okay, I need to do the setup, and it goes through and tells you those steps, right? It says, okay, it's like, hey, I do an IV setup, or I want to do, this, whatever, blood pressure monitor or whatever. And it's, all of a sudden you get these 10 steps of this is what you need to do, right? And, after a while, you do it over and over again, and then you don't need to have that extra information. But, I think AI with XR that's intuitive will transform medicine for nursing, for learning to be the nurse or the doctor, but also for the patient, right? Because so much of, you go to the doctors, if you're in the hospital, you get some training, and then you go home and it's like, okay, well, what am I supposed to do, right? A good example of this is like, the Ozempic or the GLP one drugs. Right now there's 1,500% more calls to CDC because people are not taking their dosage properly. They're doing their self-injections, and yet it was 1,500% more people calling to poison control because they're not taking it properly, and this is causing issues. So, as medicine becomes more complicated, and also patients are doing their self-treatment, that's where I think both from a clinician perspective, being trained, as well as the patient perspective, it could be very valuable.
Hey, Barton, you got a question, and then we need to move on to one more topic I want to address.
I know that the supporting nursing education, with all the wonderful capabilities to educate, to give them the ability to simulate and try it and learn and so forth, that's for me a slam dunk. The other one that you talk about and has been written about is this whole area of stress relief. And the challenge that we have with, and I don't know the phase you do, but nurses leaving unhappy, whatever, and using these technologies to drive down stress. First of all, I think I've been reading the literature properly. Is that the case? And more importantly, what exactly do these XR or even AI integrated XR technologies do to drive down stress relief or drive down stress and drive relief?
Yeah, well, I heard one definition of burnout from a healthcare professional is not being able to provide the care I want to provide because I'm just stressed out. I have too many things going on. So one, for instance, like right now, the average person, nurse has maybe 5 patients, 4 to 5 patients on a floor that they're responsible for. And what they're working on is a virtual nurse where they have a nurse that, for those things that they don't have to have hands-on, where they can have a pool of nurses that, are virtual, and then have the floor nurses do the things that are on the floor. So I'm excited about that technology. And as, AI can be some more supportive of that, and, where you have these virtual nurses come in, like, so if a patient has some questions about something, they don't need to have the floor nurse come in to answer them. They can, I hit the button and on the television appears the nurse giving that information. And then eventually, like there's Hippocratic AI, excuse me, nursing, where they go for patient education, where it's like, okay, this is what you're asking for. And we can, this, we don't even need to have a human nurse on this. We can answer it via the AI. And then if the AI thinks, okay, it's outside of my, I need more help, then you get a virtual nurse coming in to answer the question. And then if it's really needed, then you have the physical nurse on the floor coming in. So I think that what it does is it shifts the workload at the end of the day, so there's less stress. A good friend of mine who's a nurse, she's a laser safety nurse. Before she was a floor nurse, and she was just overwhelmed. I mean, there was so much chaos, and she didn't feel like she could do the quality. And she left the the hospital nursing because she just said, "Hey, this is not for me. It's just too overwhelming. I can't provide the care I want to provide." So, can we use AI and virtual systems together to have a better health
I know
system?
Tim wants to move on. Just tell us, is the
Please.
virtual AI nurse exist today? Are there hospitals
What's that?
using it?
Yeah, absolutely. Like, Children's Mercy is planning on introducing that. There's other nurses here in Kansas City where I live that are introducing this virtual nursing program. So it complements the floor nurse, the physical nurse with the virtual nurse together.
Wonderful. Absolutely wonderful. Thank you, Doug. Tim.
So in the short time we have left, you worked on a project with Cable Labs that I find quite interesting, which is on the future of aging in place, where technology played a key role. Can you just share us a little bit about what you did there with Cable Labs?
Yeah, so Cable Labs has had the 10G challenge, and they actually created 4 videos. So there's how you live, which is healthcare, work, learn, and live and play, were the kind of 4 areas. So I worked with a company called MetaView with Dr. Wagner, but Cable Labs, what they were trying to do is give a vision of what is possible in aging in place. So if you had if you had a 10G technology to the home, which is, where you have gigabit technology, if you have sensors in the home, and can you age in place so that a patient doesn't have to go to the hospital, or the office? How much of it can be done virtually? Also, you look at robotics. Can you have a robot system in place to help the person age in place? Also, like for instance, I call my mom twice a day to encourage her to take her medication. So right now we have a good system in place, but do we do more video calling? Because like right now we're in a video call versus audio. You can see so much more. It's a much more enjoyable experience. So, what the Cable Labs was trying to do is they were trying to say for aging in place, what were some of the ways we could do that? And the good news is Dr. Wagner at the KU Cancer Center, she led the program, and we won the $100,000 grand prize challenge. We won on how to use HoloLens 2, Microsoft HoloLens 2 technology with MetaView to do telemedicine. So you have a practice, a specially trained doctor being able to connect with a rural nurse or physician assistant to help people not have to go to the, like here in Kansas, instead of having to travel 8 hours to have an office visit, I can do that virtually. And that was the program that we had. But I would encourage the people listening here to go to the 10G Challenge, Aging in Place. And, it will talk about how the different technologies coming out to help with aging in place, because people, as they get older, they don't want to be moving. They like their community. And so can you help optimize their health and get them help without having them go to the hospital or the doctor's office, but you get the best care possible at their home.
Doug, I would also encourage our viewers and listeners to look at a couple of the wonderful videos that I think Cable Labs created them, but I've watched them on
That's
YouTube
correct.
of, the older 86-year-old man aging in place wonderfully. And there's some just great videos that are available as well.
Yeah, and that technology, I believe in the next 5 years will be available where, and then that will help minimize burnout to the clinicians as well. So I'm really excited about the technology that's going to be available both for healthcare and for education. The other video was around education. They had a 10-year-old girl learning about all kinds of things with immersive technology in education. And that's another video that I believe, is going to be reality in the next 5 years as well.
Tim, you're the technology guy. How do you get, this technology into the home? I mean, is it here today? Is it ready? Can we actually leverage it, or is this something that really is going to take 5-10 years to get into the homes?
Well, it's already kind of there in the sense that what we talked about earlier with the wearable devices. We've had this commercial where a woman is wearing a little necklace that you push the button and it calls emergency. I mean, that's the first example of technology being used to allow you to stay home, right? There's an emergency, you connect. Since then, you've got a lot of this technology being built into your smartphone, your wearables. My dog actually pulled me the other day, and my watch thought I fell. So I got an alert right away and said, "Did you fall?" I said, "No." There's this existing technology that what already is there for kind of monitoring, and it's going to just get better as more and more things develop. One thing Doug mentioned really early on that was really quite important is that I've always had the ability to send my data. As a diabetic, I use the Dexcom glucose monitor that I'm wearing, and I've always had the ability to send that data to my doctor in real time. He didn't want it. He's so busy. So there's going to be part of an acceptance from the medical side, as well as, what is got to be transmitted. Like in Doug's case, he calls his mother twice a day. In Japan, for example, for many years, people had Wi-Fi based kettles because they were monitoring what their parents did and make sure they were alive or okay. And they would know that at 4 o'clock was the tea ceremony at home. And if they picked up the tea kettle, this child would get an alert. Well, those type of things have been floating around for quite a while. It's just more sophisticated now.
Yeah, but Tim, the video that Doug's talking about, I looked at it recently. This is pretty sophisticated sensors.
Oh, yeah.
This is pretty sophisticated robot. I think you said, Doug, if I heard you carefully, 10K inside the home. I mean, where do you know hear that?
10 gigabit, 10G. So 10 gigabit technology. So you have plenty of bandwidth, right? And then the devices, will be integrated. Again, the key thing is intuitive, right? It just works. If you need to have an engineering degree or an IT degree to get it set up, that's not intuitive. And that's where I'm really excited about Apple's intelligence vision is it's intuitive. In fact, Apple has a 20-page document on Apple healthcare written in 2022. And I would highly recommend people reading that document on their vision of where healthcare is going in the next few years. And because it needs to be intuitive, it needs to be personal, it needs to be private. Dr. Harvey in the last session talks about the privacy aspects of that. And that, if you look at what Apple's intelligence is all looking about, is those areas. And that's where I believe you're going to go from 1 billion people having these devices to 5 billion people in the next 5 years. Just like AI, we'll have 1 billion people using AI this year. In 5 years from now, 2029, we'll have 5 billion people using this technology, making significant value to your life. Just like your smartphone, there's over 5.2 billion people have a smartphone today. You won't leave your home without your smartphone. You won't you leave your home without your smart glasses. The AI personal assistant that is watching your healthcare. Like what five, at the end of the day, this is the one thing I'll leave your guests. What five things can you do that will maximize your healthcare today? Someone you love, what five things could they do to maximize their healthcare today? And then are they doing that? And if they're not doing that, can AI give nudges, give assistance, give information, education to have them a healthier life? So ask yourself, what are five things I can do today, and try to at least do two of them, right? If it's exercising, eating right, if it's taking your medication when you should, especially if you're diabetic. Sometimes, if you're not taking your medication, again, in the World Health Organization, 3 million people a year die, of which 50% of them is not due to medication errors. So medication is absolutely critical. Not too much, not too little. The right treatment at the right time is absolutely critical. And that's where I think AI can help us with patient education and literacy to make sure we're doing the right thing.
Well, these sure are exciting times, and I can't wait to see how the next 5 years roll out.
Yeah, I'm just hoping that everyone can have a healthier life, and with this technology, I believe they can. And hopefully this technology will be used for community, so we relate better with humans as opposed to be isolated with technology. So that's the other vision I have, is if you're not using the technology to connect with people, then you're using the technology wrong.
Well, Doug, on behalf of Barton and I, thank you so much for joining us. It's been a great conversation. We could have gone on for a lot longer. For our audience, this is a great podcast to help you understand how tech is being used in healthcare, and even more layered, not only at the doctor level, but the nursing level and in the elderly level. Thank you very much, Doug.
Well, thank you.
Thanks for listening to Business Success in a Virtual World. Barton and I have helped global companies successfully develop and implement strategies to utilize these new technologies. For more information or to contact us, please visit ismguide.com and select Metaverse Resource Center. Be sure to subscribe to this podcast on your preferred platform.